What if the earliest signs of dementia started appearing decades earlier than you'd expect? Many people assume that dementia only affects the elderly, but research from top medical institutions suggests otherwise. Brain changes associated with dementia can begin in your 30s or 40s, long before any noticeable symptoms show up. This means that what you do today could significantly influence your brain health in the years to come. Dementia is an escalating global issue, impacting over 70 million individuals, with the number of cases predicted to double in the coming decades. Here's the important part: most people don't spot the early warning signs. By the time dementia is officially diagnosed, much of the damage has already occurred. However, studies have demonstrated that early detection, along with lifestyle changes, can help slow cognitive decline and improve long-term brain health. This is why it's crucial to recognize the signs. No matter how old you are, the earlier you take action, the better your chances of keeping your mind sharp. If you've ever struggled with memory lapses, difficulty concentrating, or sudden mood shifts, this is crucial information that you can't afford to overlook. The sooner you act, the more likely you are to preserve your brain health for years to come. Stay with us until the end of this video, and if you find the information helpful, please like and share it to raise awareness. Now, let's dive into it. If you're someone close to you has been experiencing memory lapses, trouble concentrating, or noticeable changes in thinking patterns, it's important to pay attention. Dementia is a progressive condition that can quietly begin years before the symptoms become visible. The earlier it's identified, the more treatment options you'll have to slow its progression and improve quality of life. So, what exactly is dementia? Dementia isn't a single disease, it's a term that encompasses a range of disorders that cause a decline in brain function, impacting memory, problem-solving, language, and even personality. Our brain holds everything that defines us: our identity, the knowledge we've accumulated, the people we love, and the decisions we make daily. But when dementia develops, it slowly damages neurons, leading to confusion, personality shifts, and trouble with everyday tasks. Unlike the normal aging process, where occasional forgetfulness is typical, dementia is a condition where brain cells die off faster, causing a steady and relentless decline. A common misconception is that dementia is just a part of aging, but that's simply not true. Research shows that people can live well into their 90s, or even beyond 100, while maintaining sharp cognitive function. This is why understanding the early warning signs is so critical. The earlier you intervene, the better you can manage symptoms and promote long-term brain health. Now, let's explore the different types of dementia. Alzheimer's disease is the most well-known, accounting for 60–70% of all cases. It's linked to the buildup of abnormal proteins in the brain, which leads to memory loss and confusion. Vascular dementia, which makes up around 20% of cases, occurs when reduced blood flow causes damage to brain cells, often following strokes or circulation problems. Lewy body dementia, which affected actor Robin Williams, represents about 10% of cases and often causes hallucinations, movement issues, and sleep disturbances. Finally, frontotemporal dementia, such as the type diagnosed in actor Bruce Willis, is less common, about 5% of cases, but progresses more quickly, often leading to early personality and behavioral changes. So, what are the 6 early warning signs that might point to the onset of dementia? Let's explore them one by one. As time goes on, some individuals may begin avoiding conversations altogether to hide their struggles. This condition, known as aphasia, was one of the first symptoms that actor Bruce Willis experienced before his diagnosis. Aphasia doesn't only affect day-to-day speech, it can also make it difficult to recall names, even of close friends and family. These language challenges arise because dementia gradually damages the brain areas responsible for word retrieval and verbal expression, particularly in the left temporal and frontal lobes. While dementia can't be fully reversed, early intervention, such as speech therapy, cognitive exercises, and social engagement, can slow its progression and improve communication. If someone you know frequently loses track of conversations or struggles to find the right words, it's essential not to ignore it. Early action can make a significant difference. The second sign to watch for is apathy and a loss of interest. Apathy, or anhedonia as it's known in medical terms, refers to the loss of motivation and interest in activities that once brought joy. If someone who used to love dancing, shopping, or socializing suddenly stops engaging and prefers to stay isolated or inactive, it may be more than just a mood change. They might begin avoiding family gatherings, withdrawing from conversations, or abandoning hobbies they once loved. Although conditions like depression and anxiety can also cause apathy, there's a key difference in dementia. Apathy often doesn't come with feelings of sadness. Instead, it arises due to progressive neuron loss and disruptions in the neurotransmitters that regulate emotions and motivation, particularly dopamine and serotonin. Research suggests that apathy can emerge years before memory loss, making it a crucial yet frequently overlooked warning sign. The third sign is sleep disturbances. Changes in sleep patterns can often be an early warning of dementia, appearing years before memory problems become noticeable. These disruptions can take various forms, including excessive daytime sleepiness. Someone who never used to nap might suddenly find themselves needing to sleep in the afternoon. On the other hand, some people experience insomnia, fragmented sleep, or frequent awakenings throughout the night, leading to chronic fatigue and mental fog during the day. Another concerning sign is vivid dreams, nightmares, or restless sleep behaviors. Some individuals experience restless sleep syndrome, where they move excessively, kick, punch, talk, or even scream in their sleep without realizing it. Research has linked these disturbances, particularly REM sleep behavior disorder (RBD), to a higher risk of developing neurodegenerative diseases like dementia and Parkinson's. But here's something even more alarming. Poor sleep doesn't just result from dementia, it may also contribute to it. Studies show that during deep sleep, the brain clears out toxic proteins like beta amyloid, which are linked to Alzheimer's disease. When sleep is disrupted, these harmful substances can accumulate, increasing the risk of cognitive decline. The fourth sign to be aware of is declining muscle strength. Dementia isn't only a condition that affects the mind, it can also impact physical strength and muscle function. Research shows that Alzheimer's disease is notably more common in women, with nearly 2/3 of cases occurring in females. While this was once attributed to women living longer, recent findings suggest that biological and hormonal factors may also play a role. As men's life expectancy catches up, the gender gap in Alzheimer's persists. A recent study in Australia, involving over 1,000 women with an average age of 75, found that those with weaker hand grip strength were twice as likely to develop dementia later in life. Frailty and muscle loss have been linked to an increased risk of cognitive decline, likely because they signal reduced nervous system efficiency and lower physical resilience, both crucial factors for brain health. Strength training and regular physical activity can help counteract this risk. Studies show that resistance exercises, even in older adults, not only improve muscle function but also boost cognitive performance by enhancing blood flow to the brain and reducing inflammation. The fifth sign to watch for is changes in sensory perception. Dementia doesn't only affect memory, it can also impact the senses, often in subtle ways that might go unnoticed by family members. One of the earliest signs is difficulty with depth perception and spatial awareness, which makes everyday tasks like judging distances, stepping off curbs, or reaching for objects more difficult. Some people also experience a reduced sense of smell and taste, which can alter their appetite and food preferences. Another key change is an increased sensitivity to noise. Sounds that once felt normal, like background chatter, music, or crowded places like supermarkets, can become overwhelming and distressing. Moreover, hearing loss is now recognized as one of the biggest modifiable risk factors for dementia. A study published in The Lancet found that untreated hearing loss in middle age significantly raises the risk of dementia, likely because the brain has to work harder to process unclear sounds, leading to cognitive strain. The sixth sign to be aware of is postural changes. One of the lesser-known early signs of dementia is subtle changes in posture and movement. These shifts are often mistaken for normal aging or mild muscle weakness, making them easy to overlook. A person might start walking with shorter, slower steps, or dragging their feet instead of lifting them properly. Their balance and coordination may also decline, making everyday tasks like holding a cup steady or using utensils more challenging. Another key sign is a gradual change in posture. Some individuals may begin hunching forward or leaning slightly to one side without realizing it. Research suggests that these changes might be linked to declining brain function in areas that control movement, similar to what happens in Parkinson's disease. Since these signs often appear subtly, they can go unnoticed unless you know what to look for. Paying attention to these early clues can help detect dementia sooner, leading to better management of symptoms and a higher quality of life. Now that you're familiar with the early warning signs, let's explore the more specific and advanced symptoms of dementia. The 10th symptom is short-term memory problems. Memory loss in dementia isn't just about forgetting where you put your keys. It follows a distinct pattern. Short-term memory declines first, while long-term memories often remain intact. A person might vividly recall events from decades ago, like stories from World War I, but struggle to remember what they had for breakfast or what they were about to do just moments ago. Beyond everyday forgetfulness, they may also struggle with abstract thinking, making it harder to understand concepts like numbers, time, or financial matters. Managing money, following a budget, or even reading a clock can become confusing. This happens because dementia gradually impairs the brain's ability to process and retain new information, making even simple tasks more challenging. The 9th symptom is difficulty following conversations. What begins as forgetting words can eventually progress to losing track of entire conversations. Someone with dementia may start repeating themselves without realizing it, struggle to keep up with the discussion, or suddenly lose their train of thought mid-sentence. They may also interrupt conversations frequently because they've forgotten what was just said and feel the need to fill in the gaps. Complex conversations, like following a movie plot or keeping up with a group discussion, can become frustrating. You might notice them nodding along without fully understanding, or avoiding social interactions altogether. As dementia progresses, language processing slows down, making it harder for them to comprehend not just words, but also tone, sarcasm, or implied meaning in conversations. Another sign is mood and behavior changes. Dementia can fundamentally alter a person's personality and emotional responses. Someone who was once kind and patient may become easily irritated, while a naturally cheerful person might suddenly seem withdrawn, anxious, or depressed. These changes are more than just mood swings, they reflect the deterioration of brain regions responsible for emotional regulation and impulse control. Additionally, some individuals may develop impulsive or erratic behaviors, acting without thinking, saying inappropriate things, or reacting aggressively to minor frustrations. Heightened suspicion is another key shift. They may start believing that people are stealing from them, misplacing items and blaming others, or feeling paranoid about unfamiliar faces. As dementia affects different areas of the brain, emotional responses become unpredictable. One moment they may be fearful or anxious, the next overly trusting or unaware of potential dangers. These emotional shifts can be distressing for both the individual and their loved ones, which is why it's crucial to approach these changes with patience and understanding, while seeking medical guidance for better management. The 7th symptom is difficulty making decisions. Dementia impairs judgment and problem-solving abilities, making even simple choices feel overwhelming. A person may struggle with everyday decisions, like determining what to wear based on the weather, how much to tip, or whether they've locked the door. Poor judgment can also lead to risky behaviors such as falling for scams, impulsively giving away money, or making unsafe purchases. As the condition progresses, they may wander away from home without notice, get lost in familiar areas, or forget to turn off appliances like the stove. These lapses happen because dementia weakens the brain's ability to assess risks, recognize consequences, and recall previous experiences, making personal safety a growing concern. The eighth symptom is a loss of the sense of time. A person with dementia may struggle to track time, leading to confusion about the time of day, the season, or even the year. They might forget important events, miss scheduled appointments, or repeatedly ask, "What day is it?" This disorientation can also make them believe something happened recently when, in reality, it occurred years ago. Losing a sense of time can affect daily routines. They might wake up in the middle of the night thinking it's morning, or prepare dinner right after breakfast. Over time, they may confuse past and present, mistaking their grown children for younger versions of themselves, or recalling deceased loved ones as if they were still alive. The ninth symptom is repeating the same questions. One of the most noticeable signs of dementia is asking the same question over and over, even after receiving a clear answer. This happens because the brain struggles to retain new information, making it feel as though they are asking for the first time, as though they are hearing it for the first time each time they ask. Beyond asking questions, they may repeat stories, forget recent conversations, or misplace objects, and repeatedly ask where they are. This repetitive behavior is not only frustrating for caregivers, but it's also a sign of how dementia affects the brain's short-term memory and its ability to process recent events. While gentle reminders can sometimes help, patience and reassurance are essential in managing these moments. The 11th symptom to watch for is urinary or fecal incontinence. As dementia progresses, a person may lose awareness of their body's natural signals, making it harder to recognize when they need to use the bathroom. They might forget to go, struggle to find the restroom, or be unable to reach it in time, resulting in episodes of urinary or fecal incontinence. Dementia gradually weakens the brain's ability to regulate bladder and bowel control, while also affecting muscle coordination and mobility. In some cases, medications used to manage dementia symptoms may also contribute to increased urgency or difficulty holding urine. Over time, incontinence can become a daily challenge that requires caregivers to assist. Establishing a regular bathroom schedule, using visual reminders, and choosing clothing that's easy to remove can help manage the condition while maintaining the person's dignity and comfort. Dementia isn't just genetic. Lifestyle, diet, and environment play a significant role in whether we develop it. Head trauma, strokes, chronic infections like HIV, and circulatory issues such as atherosclerosis and atrial fibrillation can increase the risk. Poor nutrition, excessive alcohol consumption, smoking, and deficiencies in B1 and B12 are also key contributors. A study found that over 60% of stroke survivors experienced cognitive decline within a year, highlighting the strong link between vascular health and brain function. So, can dementia be prevented? To some extent, yes. A Finnish study involving 1,200 older adults found that lifestyle interventions, including nutrition, physical activity, and cognitive training, helped maintain brain function and build cognitive reserve. Lifelong learning, playing an instrument, or speaking a foreign language strengthens brain connections and delays cognitive decline. A study on American nuns revealed that while some had Alzheimer's pathology in their brains, they showed no symptoms thanks to their mentally active lives. Exercise regularly. Physical activity increases BDNF, brain-derived neurotrophic factor, a protein that supports neuron growth and reduces the risk of dementia. Both aerobic and resistance training, like weightlifting, benefit the brain. Quit smoking. Smoking damages blood vessels, increasing the risk of strokes and neurodegeneration. Stopping early can significantly lower dementia risk. Control blood pressure and cholesterol. Hypertension and atherosclerosis are major risk factors, and studies show that statins can reduce dementia risk by 15%. Maintain a healthy weight. Visceral fat triggers inflammation and raises the risk of dementia, as does sleep apnea, which worsens brain function over time. Manage blood sugar levels. Alzheimer's is sometimes called type 3 diabetes, as insulin resistance starves neurons of energy, accelerating memory loss. Studies suggest that insulin nasal sprays have improved cognitive function in Alzheimer's patients. Prioritize sleep. Deep sleep helps the brain clear beta amyloid and tau proteins, which are linked to dementia. Research shows that people who sleep less than 7 hours per night accumulate more of these harmful proteins. Improve your diet. The MIND diet, which combines the Mediterranean and DASH diets, has been shown to slow cognitive decline, while the ketogenic diet shows promise in improving memory and cognition in the early stages of Alzheimer's. Excitingly, after 20 years of little progress, 2 breakthrough drugs, lecanemab and donanemab, are offering new hope. These immunotherapies help clear toxic beta amyloid proteins, slowing cognitive decline. While these treatments are currently expensive, they represent a significant breakthrough and offer hope for the future of dementia care. As research advances, accessibility and effectiveness are expected to improve. While dementia is complex, many of its risk factors are within our control. The choices we make today can shape our cognitive health in the years ahead. Adopting brain-healthy habits early can make all the difference. If you found this information valuable, share this video to spread awareness and help others take proactive steps. Don't forget to subscribe for more insights on protecting your brain and overall health. See you in the next video.